Looks like a billboard for a wall.
Had a wreck, need a check. All right. Ready? We'll start with the flag salute.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Morning, everyone. It's today's the Board of County Commissioners Board of Health meeting, and it's December 4th, 2023. And first on the agenda is Teresa. Can you give us a welcome?
Good morning, Commissioners, and again, welcome to the December 4th, 2023 Board of Health meeting. As a reminder to those in attendance and anyone listening or watching online, our Board of County Commissioners also serve as our Board of Health by state statute. So I am Teresa Fisher. I'm the director of the Shawnee County Health Department, and we look forward to these Board of Health meetings. We typically do 2 a year. So this is an opportunity for us to not only showcase some of the work that we're doing within our department that affects our community's health, but just as important, we enjoy being able to showcase some of our community's work, our community partners' work that is also affecting our community's health. And I think this is a good time just for us all to remember that really whether you're an individual, you're an organization, or a business, that we all play a role in our community's health. So today there'll be opportunities for you to listen and learn new ways that you can get involved to help drive the health of our community. So just a couple of housekeeping items. We switched up the agenda after it was published, so we'll still hear items number 3 and 4, but those are going to be in an alternate order today. And then I want to do just some brief updates. Today you'll be hearing from Brittany Blattner. Brittany is a familiar face. She serves as our Shawnee County Health Department epidemiologist, and Brittany will be providing our end of the year mosquito surveillance program. This is always an interesting topic and conversation, and being able to know what we saw right here in our own neighborhood throughout the surveillance season. We'll also hear from Sarah Karn. Sarah is the director for Live Well Shawnee County. This was formerly Heartland Healthy Neighborhoods, or HHN, as many of us have known it for years. Sarah is going to be providing updates about that rebranding. She'll also be talking about an action summit coming up, and just in general about the organization and ways in which you can be involved in the work that they're doing here in our community. And then we'll also hear last from Craig Barnes, who serves as our Community Health Outreach and Planning Division Manager, and Carla Hedquist, who's the Director of Community Health Engagement with Stormontville Health. And together they'll be providing an update on our 2024 Community Health Needs Assessment. So I hope the presentations today are interesting and informative to you, and the public learns what's going on within the health department and our community.
Good morning. I'm Brittany Blattner, the epidemiologist for the Shawnee County Health Department, and I'm going to give you a brief overview of our mosquito surveillance data this season. We set our mosquito traps at the same 5 locations that we did last year: Elmont, Silver Lake, Wakarusa, Alameda, and Sumner. This chart shows the number of mosquitoes collected every week from each location. As you can see, for the most part, Silver Lake had the highest numbers, especially in late July. Mosquitoes were collected from the traps every week, and we recorded how many mosquitoes were present and what species they were. The chart on the left is the chart we keep updated weekly on the Health Department's website during mosquito season. It compares the total number of mosquitoes trapped each week for the past 3 years. You'll notice that we had the highest numbers in 2021 and the lowest in 2022. The chart on the right compares the number of mosquitoes trapped for Reno, Sedgwick, Shawnee, and Saline counties in the 2023 season. Among these, Sedgwick County generally appears to have the highest numbers and Shawnee County the lowest. This slide shows the correlation between the number of mosquitoes and the weather. Mosquitoes thrive during periods of higher rainfall because they lay their eggs in standing water. Mosquitoes prefer warmer weather and are particularly active on warm evenings. The chart to the left shows the number of mosquitoes compared to the average precipitation this year, and the chart on the right shows our minimum, maximum, and average temperatures throughout the season. This season, we were able to conduct surveillance for 21 weeks from June 5th to August 23rd. Last year, La Nina brought drought to our area, which resulted in lower numbers of mosquitoes. La Nina concluded in March, but dry conditions persisted. El Nino has now started, so next year may bring more rain and greater numbers of mosquitoes. As I mentioned last year, though dry conditions result in smaller numbers of mosquitoes, they can actually lead to an increase in West Nile virus cases as water resources are more concentrated with mosquito and bird populations. People enjoying water recreations are more likely to be exposed to these mosquitoes, so there are more opportunities for transmission. When we record the species of mosquitoes we trap, we are especially noting species of the genus Culex. These are a particular concern because they spread important diseases like West Nile virus, filariasis, and Japanese and St. Louis encephalitis. This year, we trapped a total of 3,908 mosquitoes, 43% of the Culex genus. Last year, in our 16-week surveillance season, we caught 2,855 total, 47% of which were Culex. This comes to approximately 186 mosquitoes a week this year and 178 a week last year. Here are a few charts to describe West Nile virus data in both the state and Shawnee County. These charts are from KDHE's West Nile virus dashboard. On this map of Kansas, the blue counties are the ones that have reported West Nile virus cases this year. The chart below it shows state and countywide case and death numbers and rates per 100,000 from 2016 to 2023. As you can see, there were many more West Nile virus cases statewide this year than in the past 7. The upper middle chart shows the statewide number of cases this year by month. Case numbers tend to rise through the early and mid-summer months and usually peak in July, August, and September. Below this, you can see an age breakdown of cases this year. About 80% of people who are infected with West Nile virus are asymptomatic. Those most likely to experience illness as a result of it are over the age of 50 and immunocompromised, which is likely why we see an increase in cases with age. The chart to the right illustrates both state and county West Nile virus case rates over time. Again, you can see an increase in both this year. Other states in our region experienced similar increases in West Nile virus cases this year, and Colorado had a record number. It is speculated that this is mainly due to the waning immunity in the bird population. Birds are the reservoir species for West Nile virus, so mosquitoes become infected by feeding on them and then pass the virus on to humans. Therefore, more infected birds lead to more infected humans, although complex climate conditions are also a factor. All right, that's all I have. Thank you.
Brittany,
Yes.
just a couple of questions.
Okay.
So Shawnee County has been engaged in these collection of data for at least, I believe, the last 4, if not 5 years. Is that accurate?
Well, I haven't been on that long. Craig might be able to answer that question better.
Morning, Commissioners. Craig Barnes, Division Manager, Community Health Outreach and Planning. Question was how long?
Yeah.
This was our 7th year of the
Seventh.
surveillance
All right.
season.
All right, 7th year. Thank you, Greg.
Mhm.
Now, Brittany, so you've collected the data, right?
I don't personally collect the data.
But you're reviewing the data?
Yes.
Okay. So tell us what you do with this information.
I do it public on our dashboard so we can compare how we're doing this year compared to the last couple of years. Currently is how we're reporting it.
Can I be blunt?
Sure.
Who cares? If we're collecting the data but doing nothing with it, what's it matter? I'm going to ask Craig, hold on. I know Craig's already trying to jump up there. Because I think that gathering the information is only useful up to a point. If we're actually going to be productive with it, because, I mean, you've got time that's collected, we've got people's, going out and setting it, we've got your work in reviewing it, but if we're not going to actually do anything with it, that seems somewhat waste of time. And I go back to who cares? So, and I know that's kind of a flippant comment, but if we were to look at Silver Lake has the highest rate of mosquitoes, that's what you said, right?
Right.
Are we looking at bringing dragonflies to Silver Lake? Dragonflies eat mosquitoes. Are we looking at educating people on bats and bringing bats to Silver Lake. I mean, bats have a kind of a weird connotation. People get a little uneasy about bats. They feel less uneasy about dragonflies, but I mean, the three main predators of mosquitoes are dragonflies, bats, and birds. And in your information, you've already told us that birds are not great because birds can help spread disease like West Nile. So if we rule out the birds, then we're left with the bats and the dragonflies. So from your perspective, is the health department, should they be engaged in trying to find grants to introduce more dragonflies and bats to Silver Lake?
Well, I haven't worked with Silver Lake personally, but there have been some pretty significant strides made in that in the last couple of years. And Craig would be a lot better to speak to that than I have, because he's actually gone to them and discussed ways to mitigate the mosquito burden.
I mean, because the other way is through chemical application and chemical spraying, and we see that sometimes that may be short, that may have a short-term impact, but long-term impact in other ecological manners. No offense to the weed department back there, I mean, so. Greg?
May I chime in?
Yeah.
Thank you. So this is a great question. And so one of the things that I think the important things to understand about this grant is from the state specifically is it is geared towards the surveillance. There is not a lot of funding out there available to work into the control. Now, one of the things that's been great that with our partnership with KDHE has allowed us to do some of the mitigation and add some control measures into our surveillance grant. So you are completely correct. There's a lot of time that's spent in setting the traps in these 5 locations, picking on Monday evenings, picking them up on Tuesday mornings, shipping them out to the Kansas Biological Survey where they are then counted. Then they're all ground up into a mash, put through a sensor to see if there's any of the specifically West Nile virus in there. One of the things that we have done that I think, and I'm very proud of for our team here, is take in the surveillance dollars and try to maximize them into the control measures. And so some of that has been, to your exact point, is raising awareness. Now, our awareness has been a lot more around the application and the control of dumping water, standing water that you find, our dump day campaign, which we did not run this year in its entirety, just it's smaller through our social media, providing mosquito dunks. So your question about Silver Lake, so last year we had a lot of really great positive conversations with their city council and the mayor and their public works director. And so they actually shifted the way they did their chemical spraying and different applications from the granular powders and the mosquito dunks. You'll actually see that Silver Lakes, now we have 1 year of data to look at it, but the numbers went down this year with a shift in the spraying, different chemicals. It has saved the city money by not spraying as much, as well as changing the different applications.
Now, the last year was a very dry year, too.
Correct, yeah.
So you would anticipate having a decrease with it being a dry year.
Mm-hmm. So that's why we don't want to base all of our conclusions right on just this 1 year here. But love your idea about looking at different ways to incorporate looking at maybe if we can buy bat houses and providing those into communities and different things of that sort. I'm not familiar with dragonflies and how that will work, but definitely something we can look at.
Yeah, and just, again, I know bats people get a little skittish around bats.
For sure.
And makes people feel uncomfortable. Dragonflies may be a better alternative.
Yeah. And one thing that I also would like to mention as it relates to community collaborations, one of the exciting things even after this mosquito surveillance season has been some really positive conversations with the city of Topeka. So I've been really excited to be having some conversations with the code enforcement team. We're going to be providing them mosquito dunks, and they're actually, when they're out within city limits, actually going to be providing applications of the mosquito dunks in places where you see low-lying areas, standing water, and that'll be something that we'll be rolling out into the next year to really help down through the alleyways and different city-owned properties as well. We have great partnership with Parks and Recreation where they're providing mosquito dunks out on the golf courses and in their parks. I think that has been a really great benefit to the patrons that are utilizing the parks and the trail systems throughout our community, and I'm really excited to get the city of Topeka rolling on this as well.
And Brittany, I don't want you to think that I'm picking on you. I think it's important for us to collect data. It's important for us to review the data. But if we don't take the next step and actually do something with the data, what was the point?
Yes, I agree, and we can explore that further when it comes to what we can move forward.
Thank you.
And you gave us a really nice segue into, we're going to have Sarah talk a little bit about Live Well, but when we talk about the community health needs assessment, that's data. And we'll be talking about a lot of qualitative and quantitative data here for our community, and then how we tailor and move that towards our community health improvement plan. So you primed us up perfectly for our future.
Craig, Brittany, this is a toss-up question. Is Silver Lake, are they traditionally higher than other parts of is that because of the water condition back, the
It's
lake? That's
the lake,
kind of a wetlands
yeah.
back there?
Well, it's part being close to the river. You've got, you've got a low water table, you're close to the river. You have a water source that is more of a marshy
Yeah.
condition.
Yeah.
So,
Yeah, I don't know how much the river contributes to that, but when you have a marshy area where there's more water
Especially
that's
when
not
the
moving.
when the river rises and the water comes more in and off of the river, and then it traps itself in some of those areas. That's where we definitely see some of those tree hole species and different types of species of the mosquitoes really come up. Those are the ones that we're, as kind of Brittany mentioned, we're not as worried about. Really, the Culex species is the ones that we're really looking at, because those are the primary carriers of disease in our community. But nonetheless, for our citizens here in Shawnee County, any mosquito is not a pleasant mosquito. But great food for dragonflies, bats, and birds.
You have, Brittany, you mentioned there's a variety of species. That I've only known of one, the ones that bite. There are a bunch of them. Is there a lot of different species of mosquitoes?
Yeah, there are a lot.
Do we have quite a,
Bites.
just the females bite though, right? Doesn't seem right.
One thing I will add to your question there, Commissioner Rippon. So yes, hundreds of species of different
Really?
mosquitoes, and so many that are found here in Shawnee County. And actually, our primary partner, Dr. Christopher Rogers, who's been here before your board before, actually found a new species of mosquito that was found here in Shawnee County. We talked a little bit about that last time when we provided an update, but you know, that's something very interesting that's here locally that we could say is a newer species of mosquito that was identified here in Shawnee County and in Kansas.
Probably something we're not gonna mention at Visit Topeka, but, that's interesting. You mentioned something about a reservoir carrier, birds being.
Yes.
Are there certain birds that are bigger carriers than?
That I'm not sure of,
Okay.
honestly.
All right. I think that's all I have. Thank you very much, Brittany. Great. What's next?
I think I'm next. Good morning, Commissioners. I'm Sarah Carnes. Thanks for having me. I'm the director of Live Well Shawnee County, and you might be familiar with Heartland Healthy Neighborhoods. That's what we're formerly called, but I'm going to talk about that in a little bit. Okay, so here's kind of a confusing graphic that maybe is helpful. I don't know. I'll try and talk you through it a little bit. So Heartland Healthy Neighborhoods, our coalition, is we can break it down into those work groups that you see there beside the logo. Those work groups were formed from the Community Health Improvement Plan that Craig and Carla are going to talk about in a little bit. And they are the boots on the ground in the community, groups of partners from many different kinds of organizations across Shawnee County who are working on those things that you see there to the right of the logo. I think the last time I was here, I presented a check for the Trails Plan. That was part of Active Environment and the work that we do in Active Environment. So then kind of down from that, or a part of the work that we do, is the Pathways to a Healthy Kansas grant from Blue Cross Blue Shield. That grant is coming to a close, but has been really big in the work of the coalition, really helpful in funding a number of these projects. That check presentation that we did a few months ago, that was part of Pathways to a Healthy Kansas. And then, like I mentioned, the Community Health Improvement Plan and the Community Health Needs Assessment is part of the coalition's work, and really what decides our work, along with social determinants of health that we see in the community. And all of that is part of Stormont Vale, the health department, and in United Way. a little history there on the side. We've been around for a while, since 2008. I started in a little over a year ago, but the first director full-time position for the coalition. So hopefully moving forward, able to do some more work. Like I said, we're changing our coalition name. That has been part of a project, storytelling project through the Pathways grants that we've gotten to take advantage of. Heartland Healthy Neighborhood served us for a while, but we got some people together and they said, yeah, it sounds like a wheat mill or a flour mill. It doesn't say Shawnee County and health to us. So we did some workshopping and changed the name to Live Well Shawnee County, and hope that that better informs the community of what we do. You can see the new graphic has the river running through the shape of the county there, and we like to think that that represents how we do upstream work in this work, and the mission of the coalition being upstream work. Coming up very soon, this Friday, we're having our annual Action Summit. It will be held at the library. This will be my second since I've started this position, and it's a lot of work, but it's a lot of fun because this is the one of 2 times that we get everybody from the coalition together in the same room, talking about everyone's work. There are many partners from the community there, a lot of nonprofit agencies, hoping to get more local government there than we had last year. I have some registered this year. Schools, community members, just lots of people interested in the health of Shawnee County and improving those outcomes. It's really a chance to re-engage, talk about what we've done in the last year and where we're going to go in the next year. We'll also really be celebrating this name change and rebranding launch. Like I said, it's this Friday from 9 to 1 at the library. I think it will be really helpful in creating momentum for where we're going, and you can just feel the energy when you're in the room, which is really exciting, and it's so nice to hear from other perspectives. And I would love it if you all could come. Registration is open, and we have over 90 people. I think last I checked Friday it was 92 that are registered to attend. Would love to have you all there. Do you have any questions?
Maybe just a comment. I like the logo and the Live
Thanks.
Well. I think that's a better message. Just clearer.
Yeah.
I like that.
Yes.
You also mentioned Pathways for Better Health. That was a funding source for trails, or is that what that was?
So all of Pathways funding was focused on tobacco cessation, healthy eating, and active living, and from that they created this multimodal transportation package, and that's where we pulled funding for the Trails Master Plan update, and then a few other projects within the county.
And who administrates that? Where do they go to write grants for something like that?
So the Blue Cross Blue Shield Pathways team has technical assistance providers, and I would connect community partners with those providers. We do a lot of work around writing an MOU and just making sure that everyone fit the criteria that Blue Cross was requiring. And it was really beautiful in the way that it got all the partners together in writing that MOU, and then we applied for the funds.
Any questions?
No, thank you very much.
Yeah, thank you for all of you.
Good luck on Friday.
What's that?
I said good luck on Friday.
Thank you.
All right.
I would be remiss if I didn't first point off just how great a job Sarah has been doing. I've been privileged enough to have been part of the leadership board of HHN since 2016. I'm a past chair in 2019, and I will say that coalition has gone through so many updates and redevelopments and things of that sort that really started in earnest in 2014 with the development of our first chip. It has always been a very much so a grassroots, volunteer-led organization that really drives all of its work from the passion of those of us in the community, where community health and improving community health is something that's of importance to us. But with Sarah coming on board, it has really been a night and day difference. Having somebody to really be a director and to help drive the work, to work with the work groups directly, provide technical assistance. And the Pathways grant has been a game changer. And Sarah herself is the one who facilitates and administrates that grant here. There was a great team that helped write that initially, but then she's the one who coordinates through all of our work groups to figure out what opportunities for improvement can happen in our community, and then write those sub-grant pieces to get additional dollars. And I think an example of that for the county is the Trailways Master Plan, and we couldn't have done it without her. So thank you, Sarah. Appreciate it very much. So next, we're going to talk about everybody's favorite thing is data, right? And I put a couple of items in front of you all. I know, commissioners, you both have seen this both frequently, so you're welcome for some additional pieces. I know our newly returned counselor may not have seen this previously, but I wanted to provide him a copy as well. The paper copy in front of you of our needs assessment, which we're going to kind of talk about the most today, is our initial iteration. And then we did do, as you can see here on the screen, a December 21 update that talked a little bit more and drove a little bit more into the impact of COVID, talked a little bit more about those barriers. So I did want to make sure that I mentioned for anybody who may be watching or in attendance that both the Shawnee County Needs Assessment electronic copy and the improvement plans can be found on the County Health Department's webpage and be reviewed there. Can also be found on the Stormont Vale webpage, as well as Heartland Healthy Neighborhoods. So there are, or Live Well, it's going to be taking me a little bit, Live Well Shawnee County webpage as well. So, all right. So what the plan is today, we're at a unique turn in our improvement planning process here in Shawnee County. We're getting ready to launch our next needs assessment. We do these in 3-year cycles, and then they coincide with a 3-year action plan that follows. And so we are in the midst of our planning process right now for the 24 needs assessment that we'll be launching next year. So what I want to start with a little bit first is just kind of as a refresher, what is a needs assessment? And so a needs assessment is a systematic process for us and our steering team, which we'll talk about who the steering team is, because we've made some really nice improvements to it and added some partners, but really to work on doing a community perception survey in our community to get some really good qualitative feedback as what the people in our community see as their biggest barriers to health or the biggest needs to improve their health in our community, and what they see as the drivers to maybe their not so good health. And so that is a really good survey that we've had. Traditionally, really great feedback, over 2,000 respondents to a year, and we're hoping to continue to eclipse that. From there, we also look at and use our teams of epidemiologists and data analysis to look at then the quantitative data as well. And so this can include data sources through Kansas Health Matters, which utilizes and pulls from data from surveillance systems at KDHE, like the BRFIS, which is the Behavioral Risk Factor Surveillance System, as well as other data sources like county health rankings, which we do a little bit of talking about typically in March or April when those are released here in our community. From there, we analyze all that data, pull it together, and put it into a needs assessment so that we can then articulate back out to our community what our community partners and what our community citizens have told us are the biggest needs, barriers, gaps, or potential improvements that we can do around health. The biggest thing that I think has been for us, the last iteration, or last 2 iterations, has really been improving our ability to engage at the grassroots level with our community members. And so we've done a lot more of an emphasis in doing smaller focus groups and roundtable discussions with different populations in our community to get direct feedback from them. We started this 2 iterations ago. We improved upon it the last iteration, but we did them all virtually because we were doing our needs assessment process in 2021, and we were still in the middle of COVID. So I think a lot of us are really excited this year to actually get out in the community, because one of the more important things for us as a health department, as a coalition, and as the steering committee for our needs assessment and our improvement plan is to go to where people are. And we understand that is one of the biggest barriers with getting, real tangible feedback from folks is sometimes asking them to come to us. And so one of the big things that we try to do as a community is to lead some more targeted community efforts in soliciting feedback. Okay, so improvement planning, just kind of segueing into that piece because it really ties so closely into the needs assessment itself, is a continual process. And I think this is highlighted by the fact that we published the needs assessments in 2021. We hadn't had all the data analyzed yet from the COVID response. And then we were still analyzing that data and then still did an update on the needs assessment once we had more of the COVID data. Because I thought that was very important for us coming out of the COVID years to provide a snapshot in time of some of the increased barriers that we had to improving our health due to the COVID response and how that was exacerbated some of the long-standing health issues. And because of that, we even dove a little bit deeper and did a food system assessment. And so one of our priority areas within our improvement plan is access to food and ensuring a safe access to healthy food in our community. And so with that being a case, and we knew that COVID had exacerbated some of the access to food issues in our community, we partnered with the coalition and with our Shawnee County Farm and Food Advisory Council, as well as with KDHE and the Kansas Health Institute to actually do an immersive deep dive into the food system. And so that itself is a needs assessment within a specific priority area. But again, I think highlights that continual community process of not really stopping to continue to evaluate it, because what might be an issue 3 years ago, we might fix, or other issues might elevate in real time that we need to address through that. So from there, what I kind of wanted to do was just kind of highlight some of the pieces of data and positive pieces that we identified from our last community health needs assessment in 21. So as you see here, we got a really nice 2,536 responses in the survey. That was we did these in paper surveys and electronic survey through a robust network of community partners to get those out. We had 15 targeted roundtables with 148 attendees. We're going to hopefully see those numbers increasing a little bit this year as well, because we'll be able to do these in person and out in our community. And then, like I said, we had improved representation. We talked a lot about this 2 years ago when we talked about the needs assessment, but we're starting to see more representation from those subpopulations in our community, and those populations specifically that are disproportionately impacted by negative health outcomes. So we've seen our Hispanic and Latino populations increase in representation and providing feedback, as well as our Black African American population providing more tangible feedback to us and relates to helping us understand what their barriers are so that we can develop appropriate interventions. We had our virtual town hall at that time. We had 95 attendees through 45 different organizations. Sarah talked a little bit about our annual action summit coming up here. So we already have 90 plus registrants, and I'll be intrigued to see the organizations and sectors that they'll be coming from this Friday. We did add a couple of different pieces to our needs assessment the last time. We expanded the demographics, added some more information to economy, and because for us, economic development also in turn increases health improvement outcomes. And so we're looking at more of those interactions between our groups at the GTP and the economic development side, and relationships and how those partner with Momentum 2022 and now Momentum 2027. As well as I talked a little bit about the COVID impact, but then also a little bit more of a diving into the county health rankings and adding some of those. So our 4 priority areas, they didn't really change per se when we moved from one needs assessment into the next and then for the community health improvement plan. But, so we still had our behavioral health and our access to food and substance use. But one of the things that we did specifically for this last iteration of the SHIP was pull out different indicators in those areas, as well as some of the offshoot areas like maternal child health, that we knew that there was disproportional impacts on some of our populations within our community. And so from those, we started looking at more of a health equity overarching side of things when we looked at things like infant mortality and STI rates in our community. And so we pulled that out and it's at its own, within its own health equity group to give it a little bit more focus and really start tangibly working with some of those strategic partners to make some impacts in that area. So, a couple of the things that I want to talk about, noteworthy data that was in our last iteration. I think that is important to pull out and recognize before I kind of turn it over to Carla to talk about some specific interventions and our coalition impact. So, what we did see from 2020 to 21, we saw a dramatic increase in suicides. This was during the COVID pandemic. So we saw in 2020, 32 in our community to 53. This has led to some more specific engagements with our Shawnee County Suicide Prevention Coalition, as well as for us as a health department looking at some of our engagement opportunities for our public health emergency preparedness group to look at more engagement in developing community resiliency. So we've trained folks in mental health first aid and stop the bleed trainings to provide those trainings not only to our staff, but then also provide those to community partners in our community just to raise more awareness, but also have people trained to respond in these types of situations.
Craig, do we have enough data yet to know what 2022 looks like, or even into 2023?
I think some of 2022 data is starting to become more available. I don't have that handy right now, but I think that's a lot of what we're going to be looking at in 24 as we start pulling this data for the needs assessment. So I don't know that off the top of my head, but I'd be happy to go back to the office and see if we can start looking at 22.
Premature to be able to say whether or not that
is a blip in the radar or if that's a continuation. Yes, sir.
Okay.
But that is one thing that we'll definitely be looking at, and that's one of the reasons I pulled this out as a noteworthy data point to talk to.
Do you
So
think
great
there's a
question.
correlation between people being at home during the COVID outbreak and the increase in suicides, and probably an increase in drug use and alcohol?
It's a possibility. I won't sit here before you and say yes, because I don't know fully. That is one of the things that we'll definitely be diving into. But I can say on the periphery, that has been a lot of the conversation, is that behavioral health outcomes went down during the COVID pandemic. And so that's one of the things I think as a steering committee that we're really interested in looking at. And I know our behavioral health, one of the exciting things for us as a coalition, as a community, is that we've actually developed an actual behavioral health committee that is really looking at this. It's the first time in our community that partners that all work in behavioral health are coming together in one joint collaborative to really look at this and start diving a little bit more into this. So that's one of the things that committee is really going to be looking at. But I think it's hard to sit up here also and just say that there wasn't some impact. I mean, a lot of people working from home, social interactions decreased, schools closing, kids not interacting together, that we do know that there were some negatives, but we also, there have been some positives that have come out of the pandemic as well. So the next bullet point here, infant mortality rate among Black and Hispanic populations has continued has increased and still continues to stay high. And I think if you look at that specifically, the Hispanic and Black per 100,000 live births is drastically much higher than that of their white counterparts. And so that's one of the things, as we talked about pulling that out in the health equity piece, we have some great coalitions within within the health department in our community with our Fetal Infant Mortality Review Board, which acts kind of as the review team for any infant deaths in our community, and then provides recommendations then to our case action team, which operates as our Healthy Babies work group within Live Well Shawnee County, to then look at how to develop tangible and appropriate community interventions to approach and make an impact on that infant mortality rate in our community. Sexually transmitted infections as well, again, higher among Black and Hispanic populations in our community, as well as young adults. Another thing that has come out of this most recent iteration of our Community Health Improvement Plan has been the coming development of a sexually transmitted infections collaboration that will be diving a little bit more into this. This is on really in the development stage right now, and excited. I think that by 2024 we will have a working STI collaborative that will be diving a little bit more into those sexually transmitted infection rates in our community, and looking at, again, how to partner effectively across all sectors, and then specifically targeting these groups that are disproportionately impacted in our community. And then also, and Commissioner Rippon, you kind of talked to this a little bit, but we also saw an increase in drug poisoning deaths from 2020 to 2021, highlighted again specifically about synthetic opioids. We have a substance misuse task force here in our community. The health department has specifically put opioids and substances of misuse higher on our priority list that we have been diving a little bit more into, and looking at more opportunities to collaborate there. I think one of the things, again, on the data side that we're looking at in the opioid spectrum is how can we provide tangible data and real-time data to our community that is something that can be acted upon. And so I'm excited, and maybe I'm jumping the gun here a little bit, Teresa, so I apologize, but one of the things that we're really excited to look at into 2024 is developing a public-facing dashboard as it relates to substance abuse, specifically opioid overdoses in our community, and providing that real-time data out to our community stakeholders, so there's actionable data, again, to work from in real time. So that's a little bit on the data. Any initial questions for me before I turn it over to Carla Hedquist from Stormont to talk a little bit about what Stormont's doing, and then our steering committee and moving into 24?
No, thank you, Craig.
Why do you think there's a disproportionate mortality rate for infants due to race?
Yeah, that's a loaded question. And I think, it could be multiple reasons. I think some of it can potentially be education. Some of it can be access to care. It can be trust between a pregnant mother and her provider. It can be barriers between understanding. If your provider is, say, white and you are a Hispanic, maybe a language barrier between, and not being able to articulate feelings or needs while you're pregnant. It could be safe sleep environments. It can be environmental things within the house. It could be a lot of different things. And so I think one of the biggest things for us as a community is putting things in easy to understand as well as in multiple languages, and really pushing out the education around safe pregnancies at both preconception, right, before you even are pregnant, and then in that prenatal piece while pregnant, and then even right after birth in those first weeks are pivotal in the health of a newborn. Did that kind of answer your question? I know that was a little
It seems like
all over the top of the place,
we have a lot of programs, spend a lot of money, and it doesn't seem like I don't know, maybe we are making headway. I don't know.
I would say by just from the health department perspective of seeing engagement in our baby basics classes, and the participation that we've been having there. The community baby shower that we just hosted was very well attended. The education that was provided out there. I think it's increasing. I think you're right. There are programs out there. Our newborn home visitation programs that are going into the house, I think, are very important to provide education and resources to first-time mothers and mothers with newborns that are below the federal poverty guidelines. And so you're right. There's a lot going on, but I still think that there's a lot more. And there's avenues in our community that we just have not yet been able to reach. And that is, again, why it is so vitally important for us to have these community collaborations from some of the partners that we have here, today, and then that serve within Live Well Shawnee County, because they're the partners that are working day in and day out with a lot of these clients that we're trying to reach. They are the trusted agents that are working with those. And so we have to figure out how to support them, provide them the correct and valuable information to make impacts within those small family units, as well as those populations.
Has anybody ever mapped graphically on geographically on a map where you have infant mortality, more of it, just so you can focus on a certain group or area?
Yeah.
Has that ever happened?
It has happened, and I mean, and that is exactly why some of our outreach opportunities with community baby showers and specifically have targeted specific zip codes. I'm going to look at my colleagues here, but we still have the highest, we have a zip code within our county that has the highest infant mortality in the state, is that correct? 04. So our 66604 zip code within Shawnee County actually has the highest infant mortality rate in the state. And so I can tell you firsthand that our Healthy Babies work group specifically looks at opportunities to engage stakeholders and partners within that zip code, as well as where we look at opportunities to do either satellite presentations or groups, so that we're, again, to what I said earlier, meeting people where they are and trying to provide that. And sometimes it's access, sometimes it's, again, it's so many different things, and I can't speak to one individual's, what their needs are without having those conversations. But I think that's why these important conversations, or these conversations are so important. It's a great question. Okay, I'm gonna turn it over to Carla Hedquist from Stormont Vale. She's gonna talk to you a little bit about our next steps and a little bit of what Stormont's doing.
Good morning, Commissioners. Carly Hedquist, Director of Community Health Engagement for Stormont Vale Health. I'm glad Craig left this screen up because it's very sobering data. And Commissioner Cook, I agreed with what you had to say about so what? So what are we going to do with it? And this is community level data, and it's not a work group through Live Well. It's not one organization that can fix these kinds of startling disparities within our community. But if we all are working on those goals and we all are doing something towards that, then we will see improvements. And so that's what Craig asked me to come talk to you about today, is what Stormont Vale Health is doing to work towards our community health priorities. So like Craig said, you'll find the Community Health Needs Assessment and the Community Health Improvement Plan on our website, but you'll also find an Stormont Vale Health's implementation plan. So as a nonprofit hospital, we are required to do a Community Health Needs Assessment. We are also required to do an implementation plan. So what are the community priorities and what are you doing to meet those needs? We don't have to meet every need, but if it's something that we're not addressing, then we have to address that in the implementation plan. So that's on our website as well. We have a community pillar that is part of our strategic plan. And every strategic plan, we focus on new goals every year. I also present our Community Health Improvement Plan priorities and this kind of data to our directors across the system. So as they are working on their strategic plan for the next year, they can develop that into their department priorities as well. So examples of what we're doing at Stormont Vale Health. During the pandemic, the K-State Extension put together for Shawnee County an interactive food map. Simple tool for Shawnee County. Somebody can put in their zip code and find out food distribution sites near them and when it is. So what we've done at Stormont is taken that to a new level. For individuals that are food insecure, that we ascertain as part of a social determinant of health survey that they complete for us, then in their after visit summary, the link to that interactive food map, it's a QR code and also a website link to take them there. It's automatically in their after visit summary. It's also automatically embedded into their MyChart messages so that they have the resources right there. We also have a grant from Advisors Excel that we started within our endocrine clinic, and we cascaded that across the region. At first, we partnered with Harvesters for healthy food boxes. So these would be individuals that are food insecure but have very high blood glucose levels, very high A1Cs, 9 and 10 ranges, which is very high. 6 is below 6 is normal. We're now partnering with Walmart so that we can help somebody order the healthy lean meats and fresh produce, a time to go pick it up, and then we're using that grant funding so that the individual can go pick up. And we are seeing wonderful improvements in individuals. They're learning to cook healthier, and their blood sugar levels are dropping. Our organization for years has partnered with Meals on Wheels, just doing deliveries, and we do that 3 days a week. We also have a new focus on volunteerism that is aligned with our community health improvement plan. So we publicize volunteer opportunities in our community that are aligned with our strategic plan and our community priorities. So when you talk about collective impact, that we are driving people to those things that we believe will improve social determinants of health, those upstream things. Doesn't say that they can't volunteer anywhere else or that can't do what they want to, but we are trying to encourage people to participate in those kinds of activities. Substance use, med disposals at our pharmacy, publicizing the Take Back Days. We have a contract with Central Kansas Foundation to do all of our substance use disorder screening, and they actually provide transportation to treatment. And then we have an internal opioid committee made up of physicians and providers, really looking at not only community level data and national data, but Stormont's data. Within the behavioral health priority area, we are constantly looking at access. You know, access has to deal with, do you have enough providers to see the number of patients? We're seeing more acute needs, which means we need to keep them in treatment longer. We are doing some training for students, so that increases our number of providers and is hopefully a workforce pipeline for us as well. The Zero Suicide National Initiative, we have recently written a grant to provide more training for our providers across the organization to meet suicide prevention needs. We partner with our community partners to bring continuing education for behavioral health providers to this community. There's no need for the health department or Vallejo or us to do our own thing. It's important for us to come together and hear it and work on the same initiatives and best practices. We do a oh, and then, of course, we participate in community education things like the NAMI walk and the suicide prevention runs. What I think I want to talk a lot about is health equity, because that's something that Stormont Vail has made a priority within our strategic plan. We now have a community committee of our board. It's an advisory committee to our board of directors. It's made up of more culturally diverse individuals to give us more feedback about what we need to hear from our community. We are working on internal dashboards that compare demographics. We started a We Ask Because We Care campaign, and that is to collect better racial and ethnic minority data. So that, why would we do that? And that's so we can provide better interpreters and better quality of care that's tailored to individuals' needs. We have, we do social determinants of health questionnaires with patients, and it asks like 9 or 12, a variety of questions: food insecurity, financial, intimate partner violence, those kinds of things. And if they answer yes to any of those things, then we are working with them on community referrals. And we belong to a group called the Community Referral Network of Kansas, which is, it used to be Healthify, and now it's used a company named WellSky. And so those referrals are made electronically, right? It's embedded within our medical record system, but it's a closed loop referral system so that we can see if those referrals were picked up in the community and those individuals are getting what they need. We are very focused on Black maternal and infant health. We are partnering with the March of Dimes on a national campaign, and we are implementing team birth, which is more inclusive ways of including moms and providers and family members as part of the planning team, so that the mom is the lead when she is delivering a baby. So at what point in the delivery are they, and then what are the mom's preferences? What's the outcome that she's looking for? And so she's guiding that process. We also do, in addition to participating in the community baby showers, we also do Welcome Baby Jubilee, which is community organizations, again, coming, and we do lots of booths so that expecting moms can walk through. We also offer tours of our birthplace. We have a grant from Topeka Community Foundation called the LINK Partnership, and that's low-income, uninsured residents of Shawnee County, and it's Vallejo offers community support navigation or case management so that we can refer hospital referrals who meet those criteria to that case manager who can work on those upstream social determinants of health. Health Access, a program of the Shawnee County Medical Society, actually lives at Stormontvale Health. We donate space to them. They coordinate care for low-income uninsured. We rolled out our mobile clinic a few years ago, and we partner with the Mobile Access Partnership on Tuesdays and Thursdays, and the other 3 days of the week we are out at community locations, a lot of the community centers. We're at the library in Rossville. Walk with the Doc, easy monthly third Saturday initiative where individuals can come. It's free of charge, meet a physician in a different kind of way, ask informal questions as we walk around Washburn University. So it's an opportunity to model that kind of healthy living and activity. And then we are very focused on implementing a new language and interpreter program for certification across our region. So like Craig said, we are part of this cycle of every 3 years, and we are busy planning our 2024 Community Health Needs Assessment. The surveys will be open March 11th through April 30th. Our steering committee has expanded. The last iteration, it was the Heartland Healthy Neighborhoods, which is now Live Well, Stormontvale Health, the Health Department, and United Way. And really with the Community Health Needs Assessment, it's the Health Department and Stormont that take the lead because of our accreditation and IRS requirements. And then the Community Health Improvement Plan that follows the grassroots community work, that's led by Live Well and United Way. But we've added some very strong players to our leadership team for the 2024 implementation. Vallejo and Family Service and Guidance Center have joined our leadership team as part of their CCBHC requirements, Certified Community Behavioral Health Center requirements. University of Kansas St. Francis campus has been an active member of our planning team, and Grace Med, they are involved in community health needs assessment planning because of their FQHC status. So we are meeting monthly right now. We will be ramping that up after the first of the year, meet bi-weekly, and then when the survey is open, we actually meet weekly because we are looking at those demographics as they come in. We haven't heard much from Silver Lake. We haven't heard much from Rossville. Does anybody know anybody in Tecumseh that we can, how can we engage? You know, this age, this ethnic minority, whoever, to try to figure out how we can get representation that accurately reflects our community. We have been going through our survey and updating the questions to make sure that they're easy to read and get to the issues that we want addressed and in a fair and impartial manner so that we're not loading the deck. We will offer the survey in English and Spanish and large print. Like Craig said, we do targeted roundtables with underrepresented voices that we really want to hear their feedback from. And then we will be looking to you and other community partners to help us cascade the survey because it's very important that we get a robust feedback so that it represents our community. we take the community perception data, and then we combine that with the county health rankings and the demographics of our community and other data sources, and then we have that community conversation. It's a town hall. It will be in May, and it will roll out the county health ranking report at that time as well, so that as we're looking at what our priorities are for the upcoming 3 years, all of that is considered. We'll have the written document similar to what you have in your hands completed by the end of the year for our 2024 needs assessment. And then we'll start work on our community health improvement plan.
Any questions for Carla?
Carla, page 7 of the Community Health Improvement Plan identified that with the current Polk Quincy Viaduct project, this will be disrupting the food system for population of focus and those who support food security work. As 2 organizations that are significantly impacted, Let's Help will be displaced, and Harvesters has announced a move to a neighboring community. Both of those things have happened. What have you seen from where you're at on the impact on those 2 things happening to food security in Shawnee County?
What I'm hearing from community partners as part of a United Way weekly call is that the food banks are struggling with enough food to distribute, and that the need has remained high as far as individuals who are needing food. We have 2 work groups that focus on our community. One is the Shawnee County Food and Farm Council, and it is more of an advisory committee, a higher level committee that gives feedback to the city and the county and works on things like the Shawnee County Food Assessment. And then we also have a healthy eating work group through Live Well that is focused on those kinds of issues. I don't sit on either one of those, but I don't know if Sarah or Craig has any deeper information.
And I thought I would ask, by the way, because as I look at the leadership team, we've got the leadership team sitting here in the room with us, and so I thought I would go directly to the source.
Yeah, I serve on the Farm and Food Council and sit on healthy eating as well. And something that we've talked a lot about is, you probably know Let's Help has moved to the 6th and McVicker-ish area. With healthy eating and active environment, we worked on that or had conversation about that because of the way that has changed access to folks who were going to Let's Help down by where the viaduct project will be. We're worried a lot about safety of people crossing McVicker. When I go to the health department, it's a little nerve-wracking myself, but I just imagine someone who's also trying to bring along kiddos or has a physical disability or something like that. So that's certainly a concern in terms of food access and healthy eating.
And specifically, the concern you're talking about is with the parking lot being on the east side of McVicker and then getting across McVicker to access the services.
That, and also if people are walking from wherever, in town and they have to cross McVicker, it could be potentially dangerous. Yeah. And then, as Carla said, just the supply of food is really low, and that's certainly an issue.
With Harvesters moving to Lawrence, they're still doing projects within Topeka. Harvesters are still active in the community, even though they may not be headquartered here, correct?
Yes, correct. Mm-hmm.
When you evaluate what is a food desert, is it based mainly on just how far you are from a grocery store? Is that basically what you're saying?
Currently, that is the metric in an urban area. It is if you are less or over a mile away from a grocery store, that is considered a food desert.
So everybody in western Kansas is in a food desert then, I suppose.
A lot of them, yes. And when you, it's different in a rural area. I think it's 5 miles.
Yeah,
Mm-hmm.
Do you take in consideration the people that live in those areas, do they have access to, do they have a car? Do they, I mean,
Yes, that's
are they
certainly.
afoot, you know?
Mhm.
That's
Yeah.
a huge difference.
Or if you
know,
ride the
a lot of
bus
people
and you
live
only
out in the
can take
county,
one
but-
back.
And they don't feel like they're in a food desert because you jump in the car and you drive to the grocery store. But I didn't know what all was considered in creating these maps. Well, all right.
May I add to that too, real fast? I think one of the important things on the food access side to kind of answer your, just add on to the question you asked. One of the things that we look at, and I think, and Carla kind of talked about it with the K-State Extension Office, the food distribution map, you know, we look at those. And so when we look at it and work as a steering committee and as a work group, we're overlaying all those data layers together. So, well, yes, a community might be listed as a food desert. We also look at, okay, what does the community garden network look like through Topeka Common Ground? What is the accessibility of sidewalks and things of that sort, so that if somebody does not have a vehicle, are they able to walk to either a community food distribution location, whether that's like Catholic Charities or food pantry? One of the things I think that has been intriguing and has been communicated is also now that a lot more of those they used to be called little free libraries, and they used to be books. But now you're seeing more and more of them popping up that are actually like pantries. And so one of the things that I've heard communicated through community partners is there an ability to also map out those smaller pantries at a much larger scale? Some are already identified, but more and more are popping up on a weekly, monthly basis that you don't know about until you drive by. So we try to look at as much as possible, and I think that's why it's been paramount for us as the Live Well leadership, as well as the Farm and Food Advisory Council, that the food priorities, is that something that we look at and have done supplemental food system assessments as well to get some additional feedback and do some additional data gathering that dives in a little deeper.
Any other questions? All right. Thank you, Carla.
That's us. All yours.
That concludes today's Board of Health meeting. Hopefully, again, you got information that was informational for you, and hopefully you and the community have ways to get involved here. I know that Sarah is hoping to see lots of our faces there and the community's faces at the Action Summit on Friday. Our next Board of Health meeting will be in the spring of '24.
All right. All right, thank you, Teresa. Last thing on our agenda is public comment. I don't think we have anyone here, but if you'd like to speak on the subject, you're certainly welcome. I don't see anyone. All right. Commissioner Cook, you have any final?
No?
All right. Then I guess we're adjourned. Thank you very much.